You've been around for how long? How long has the organization been around?
We've been around for 52 years.
Wow. You would think that everyone would know about you by now. How important, especially now, your organization, you're seeing a lot of, sorry for the ding, a lot of new people or people are realizing now who may not have needed your services now who are?
Yes. Yes. So we have about 25% of our patients are uninsured. And what's happening now is that there are people who have traditionally had insurance and now they've lost their jobs because of coronavirus and because of being unemployed at the moment. And so we have people coming to us who are not traditionally uninsured and don't really know how to manage that.
Wow. How tough is it staying, like you said, you're doing okay, but how do you get funded? I mean, can you take help from the community? Because this can't be easy, because for those of us who can help out, are you accepting the help and how do you fund all what you do?
Yes, absolutely. We appreciate all of the donations we can get. The work that we do is difficult, challenging, and not easy to fund necessarily. So overall, about 17% of our budget comes from a grant from the federal government, and the majority of our funding is from billings from insurance. So
Okay.
most of it is from billing Medicaid, Medicare, and commercial insurance. But we do count on our donations to help fund some of the projects that don't produce any revenue, and then to help with the uninsured patients who don't cover. Our uninsured are taken care of on a sliding fee scale. So if you come in and you live below the federal poverty line, you pay $10 for a medical visit, no matter what we do, and $40 for a dental visit.
Jerry, the neighbor, wanted me to ask, what else? I thought he mentioned you don't do pick up people, do you? Or rides? Or that was
We
something
do.
he wanted me to mention because a lot of
Yep.
people don't have vehicles or they're losing vehicles or they live in an area where they can't. So that is true.
We do. We have transportation services. We have vans that drive all over and pick people up and bring them to our sites and take them home. We also provide eye care. We have OB-GYN services. We provide women, infant, and children's services. We have pain management, alternative pain management to help people with pain trying to avoid narcotics. We have behavioral health services, substance use disorder services. We do all rheumatology. We basically try to meet community needs where we see that we try to partner with the community. So if there's someone in the community who can provide for our patients, that's where we go. But if we can't find that, we try to create it for our patients. So we have pharmacy services. We do delivery with our patients to get medications to them because many of them have transportation problems. Right now, we're doing a lot of telehealth visits since the coronavirus started. So at the peak of the stay home, stay safe order, we were doing about 70% of our visits by telehealth.
Wow.
Now we're down to about 35%. We started welcoming patients back into our centers. We restarted doing x-ray. We have always done emergency dental. We never closed our dental services, but now we're open for traditional dental too. And it is critical for people to understand the need to get your dental care now, because if we don't take care of our teeth now, next year you're going to have problems with dental caries. And with dental caries, poor oral health, you increase your risk of heart disease, and diabetes becomes less well controlled. It increases your risk of having preterm births if you're pregnant. So it's really important to do that. In addition to, there's been a national problem since coronavirus started of decreased vaccination for kids because people aren't coming into the office. So there's a big concern that if kids don't get vaccinated, we're going to see a recurrence of measles and mumps and rubella and all of those diseases that we have fairly under control. So it's really important to start doing that.
Sorry to interrupt. Are people scared to come in because of the coronavirus, or are their minds just occupied with other things, or a combination?
It's a combination. So we have some patients who are really frightened to come in, and we try to take care of them by telehealth if we can. And then there are people who are challenged by transportation and can't get in for a variety of reasons. So we work with our patients to figure out what works best. We actually have telephones in our parking lots, so you can do a telehealth visit from the parking lot if you don't have capability, if you don't have phone capability with enough cell service to be able to do that from home. Cool. We can do it from the office. And there are some people who are very frightened to come in. We've put in a lot of safety measures. So our patients, they wait in the car until there's a room ready for them, so they're not waiting in the waiting room. if you come in by bus or another way, you can wait in the waiting room, but the seats are all separated at least 6 feet apart, and we minimize the number of people in the waiting room. We schedule so that we don't have everyone there at the same time. We alternate our telehealth and our in-person, so we kind of make sure we don't have too many people in the building at the same time. We have x-ray services and mammography services, and they're spaced out so the patients aren't there at the same time, because we're minimizing any exposure.
So don't wait or delay vaccinations. That's the necessity, you're saying.
That is critically important, because if we get through coronavirus and then we have a big resurgence of measles, we have not won the war.
We did a story on that recently, but are you seeing that? I think other doctors are as well. They're seeing people not getting the vaccinations.
There are a lot of people who refuse vaccinations, but right now it's even people who don't refuse them. They just haven't.
Well, that's what I mean. Because of coronavirus, it's pushing the MMR, the mumps, the rubella, those off.
Right. And so I think that fear of coming in really is something we need to speak to. We check all of our patients before they walk in the door. So we check their temperature. We make sure they're not ill. If they are, we triage them and manage them separately. Because if you need to be seen and you're sick, we'll see you. But we do that in a way that keeps everyone safe and doesn't get anyone exposed, minimizes exposure of anyone. Okay. And then after you've come in, we have, plexiglass and shields in place. So there's no, between our staff and the patients at the front desk. And then every one of our staff wears masks inside of the building at all times, anytime they're within 6 feet of you. So we have done everything we can to minimize exposure. We're trying very hard to keep our patients and our staff healthy and safe.
Exactly. I want to ask, because it's timely, coronavirus testing. In the beginning, the governor, the president, Dr. Birx, Dr. Fauci said, only be tested if you're showing symptoms. Well, now we're in a different phase. That has changed. So who can get tested now?
Right now, our sites test anyone. So anyone who walks up or drives up and wants to be tested, we will test. It's recommended that you get tested, obviously, if you have symptoms, but if you've been exposed, you should get tested. If you are in a job that you tend to be exposed, so if you have a high likelihood to be exposed. So the governor's recommendations right now are that if you are in a nursing home or if you work in healthcare, you get tested every 2 weeks regularly. So we have many of our staff get tested every 2 weeks to make sure that we're not giving it to anyone.
How busy are you when it comes to the testing? I'm assuming you are very busy with that.
We are. The testing sites have been incredibly busy. So we started out pretty slow, and we were trying to advertise because we had people sitting there ready to test and no one was coming in for testing. And you knew that there were people who had disease because you saw the numbers rising, but no one was coming in for testing. Now we've advertised and people know that we're there often. So we had on Monday, we actually had 152 people we tested at our site here in Saginaw.
In one day?
9 and 4, yeah.
Wow, in one day. Do you get results? How does that work? They get results in a few days, or how's that work?
Generally, our results come back within 2 or 3 days. Okay. Every once in a while, the lab will have a glut of tests and it'll take up to 7, but generally we have them back within 2 or 3 days. Sometimes in 12 hours, but it's different. So our site here in Saginaw now tests. We changed the hours to 7:30 to 12:30 to take people out of the heat.
Wow.
So Monday through Friday, 7:30 to 12:30.
I just thought it's one of my last questions. It's important not to ignore your health in general. I mean, we focus on COVID-19, obviously, but there's so many other health aspects. You need to keep up on your health, correct? There's so many people that have chronic issues that they need to constantly look at. And I see that with sometimes my own family or others. You need to remind patients, hey, make sure you're taking your medicine, make sure you're having your checkups, because that's really important, right?
It is terribly important. Actually, the rate of heart deaths has increased since coronavirus has been here. And it appears that people are not taking care of their chronic diseases as well. So people with diabetes, hypertension, asthma are afraid to come in. So they don't come in when they're ill. And the rate of deaths outside of the hospital has gone up fairly significantly because people aren't getting treated. It's really critical that people come in and get treated.
So that could possibly easily be prevented.
Correct. That's what we're working to do. So we're calling our patients. Like, you haven't been here. You've got diabetes. We need to check up on you. Wow. Can you come in? If you can't come in, we'll get the tests done outside of a visit. So we have the information when you come in for a visit. Or we've been prescribing blood pressure cuffs to our patients with high blood pressure so they can check their blood pressure at home, and we can do a televisit to control their blood pressure medicine.
Gotcha. Okay. What's the number one message, I guess? Is it still okay to, you have so many clients, but you can take more? I mean, how does it work if there's no limit as to the need? Because the need's growing in the community, but you're always available?
Yes, the need is growing, and we have everything. We do everything we can to provide for the patients who have the need. We're very concerned about the behavioral health need following behind the coronavirus. There's a lot of despair, a lot of people who are struggling with hope because this coronavirus seems relentless. It just keeps going. And so we're doing a lot of work trying to figure out how to support people, help with possible depression, other diseases. That anxiety has been huge. So working with our patients to be sure you take care of yourself. We need self-care. We need to eat well. We need to exercise. We need to make sure that you socialize, perhaps not physically, but call people, check on them, do the touch, because we are social beings, and that social relationship is really important to our health.
Good message. Good point. I think everyone in the medical profession would agree with that. Okay. Anything I missed? Anything that people should know about your organization? And I will link to the website in the story. I'm assuming if there's someone wants to donate or help out, they can find in the link. They could on your website. They can do that.
Absolutely. And right now we're asking, especially for donations of masks, because when people come in the door without a mask, we give them a mask. So not only are we, cloth masks, our staff has personal protective equipment, but to purchase another set for patients is another, it's just more expensive than it used to be. So the costs of taking care of people in coronavirus are pretty daunting, but we're doing our best, and we're going to keep doing what the community needs. The other thing I would like to mention is that we have a pop-up testing site on July 14th, Tuesday, July 14th,
Okay.
from 10 a.m. to 12 noon at 3121 Sheridan, New Birth Missionary Baptist Church in Saginaw.
Okay.
So that is, we're planning on a lot of people. We staff it with a lot of people so we can get people driving through, get tested, and move on.
Just drive right through.
Drive right through.
Is it the notice?
It's really important to mention that if you come for testing, be sure to bring your insurance card and your driver's license if you have it.
But you don't need a prescription to.
No, you do not need a prescription, and if you don't have insurance, you do not have to pay for the testing. But if you have insurance, bring the insurance card, because the government pays for testing for uninsured, but they check. So if you have insurance, they catch it on the back side. It's way better if we do it right on the front side.
Oh, I didn't know that. Okay. And is it the test where the swab in your nose thing? Okay.
So the nasopharyngeal swab is much more accurate.
Oh, that's why it's best. Okay.
Yeah. So the oropharyngeal may be only 60% accurate, 75% accurate. And our purpose in doing the testing is to change lives, save lives. And so I want to know if you are positive so you can prevent giving the disease to other people.